This is another specimen of the heart, in which this is the sternocostal surface. The right border is made by the right atrium, where the superior vena cava enters and the inferior vena cava enters. And this is the AV groove, this is the right coronary artery. It arises from the anterior aortic sinus. And this is the ascending aorta. This is the arch of the aorta with the three great vessels. This is the pulmonary trunk, giving the left and the right pulmonary artery. And this is the apex of the heart, which is made by the left ventricle. And this is the left coronary artery, which is cut. It gives the anterior interventricular artery and the circumflex artery. Here is the base of the heart, which has been destroyed. And this is the left atrium, forming the base of the heart, with 4 pulmonary veins entering into it. Here is the papillary muscles, but it's not important in the practical exam to know the papillary. This is the interventricular septum between the right ventricle and left ventricle. And this is the left ventricle open, where this is the mitral valve, and here is the aortic valve. And this is the vestibule of the left ventricle. And this is the papillary muscle. We have 2 papillary muscles, one anterior and one posterior. Another specimen will be this heart. This is the sternocostal surface. And this is the superior vena cava, which is formed by the left brachiocephalic vein, right brachiocephalic vein. And this is the right atrium, which forms the right border of the heart. If I open the right atrium, this is the crista terminalis. And this is the fossa ovalis. And this is the annulus ovalis. And this is the tricuspid valve. And this is the opening of the inferior vena cava. And this is the opening for the coronary sinus, which lies between the opening of the inferior vena cava and the tricuspid valve. I'll find the opening of the coronary sinus. This is the right coronary artery, arising from the anterior aortic sinus, as passes in the AV groove between the right atrium and right ventricle. And this is the right ventricle opening, where you will find the papillary muscles with the chorda tendini and part of the valve, tricuspid valve. And here is the anterior interventricular artery, a branch from the left coronary artery, and this is the left coronary artery. It gives the circumflex artery and gives it the anterior interventricular artery. The anterior interventricular artery passes with the great cardiac vein, which form the coronary sinus. If we look to the diaphragmatic surface, this is the diaphragmatic surface, and this is the posterior interventricular artery. With it is the middle cardiac vein. The middle cardiac vein opens into the coronary sinus. And this is the base of the heart, which is commonly tied in the practical exam. This is the left atrium, forming the base of the heart. Characteristically, 4 pulmonary veins open into it. And this is the pulmonary artery. And this is the arch of the aorta. And this is the ligamentum arteriosum. And this is the 3 branches of the arch of the aorta. This is the left common carotid. And this is the brachiocephalic, which gives the right common carotid and right subclavian artery. And the third, this is the left subclavian artery. And this is the descending aorta. If I put my finger here, posterior to the ascending aorta and pulmonary trunk, so I am in the transverse sinus of the pericardium. The transverse sinus of the pericardium. Stop.